we're going to be augmenting your chin today. How do you feel so far?
It's good. No pain.
One Chicago plastic surgeon is not only changing the face of his patients, he's also changing the way people look at facial plastic surgery. This chin augmentation we're seeing is the 7th procedure that Dr. Shah has performed live on Facebook. Dr. Shah joins us live right now in the Fox 32 studios, right up here off of Michigan and Lake Street. Dr. Shah, thanks for joining us. We were watching you perform a procedure yesterday. Not only are you changing your patient's face, but you're answering questions from Facebook Live viewers all at the same time.
Yeah, it's like the ultimate form of interaction for patients, and it's an impressive educational tool. And what I'm doing is sort of bringing this academic forum where you have live surgeries where usually other physicians are watching, and now prospective patients and people who are curious about the procedure can ask me or ask the patient any questions they want during that time period.
So instead of just going on your website and maybe looking at some before and after pictures, they can actually watch you do this if they're considering having a procedure done just like this.
And it's like a chance for you to actually experience what it is through not just my perspective, but also through the patient's perspective. And if someone's getting filler, you can ask, does this hurt? How does this feel? If you're getting a chin augmentation, what are you feeling right now? What are you experiencing right now?
I was just amazed that this guy was awake while you're, doing a chin augmentation. Should he be knocked out? Should he be answering questions?
Well, I think with a mild relaxing medication like Valium and the patient's relaxed, and if you put local anesthesia, if the patient can't feel anything as far as discomfort, it's actually quite comfortable. So part of the reason we're doing this is so for some patients will say, I'm really afraid to get a chin augmentation. I need to go to sleep. And if they see a patient who's doing well and saying, this is really comfortable for me, maybe it'll change their mind about doing this procedure under local anesthesia.
You and a number of other doctors out there, plastic surgeons, are doing this, and they have millions and millions of followers. People really get into this, and you want people to know that this is not just something that you're doing. The patient gives you permission to do this. You're not just putting them in the operating room and doing this on them, doing this with them.
Yes, exactly. This is a select number of patients, and patients actually volunteer to do this.
Wow.
And the way this started was there was a procedure that just became FDA approved called FaceTight, and I was trying to describe it to a patient, and we looked at websites and pictures and things of that nature, and the patient said, why don't we do this and show everyone on a video? And we talked about it a little bit more and said, the best format to do this is Facebook Live. Wow. And the patient had such a great experience doing this and talking to her friends and colleagues and interacting that we thought this would just kind of run with it.
You also want people to know that you're not doing everything live on Facebook Live. Not the entire procedure is seen by everybody at home. Only certain portions of what you're doing. And you also want to answer the question of should you be doing this, doctor? Shouldn't you be concentrated on me, the patient, other than people out there looking through the camera?
It's a great question. And so if you're doing a procedure, for example, if a procedure is 30 minutes or 40 minutes, during this procedure, if there's a minute or 2 minute portion of the procedure where viewers can see this, for the educational elements of this, for other people to experience this and to educate other people out there, I think it's worth that. And we're not losing any quality in the results. And all of our
integrity for you as a doctor.
Absolutely. And so far, all of our patients who've had this done are doing great. And the interesting part of this is it's not just a one-time you see their surgery, you can actually see the recovery, how they're doing.
Okay. Is there anything you won't do on live Facebook? Procedure-wise?
Well, other than people who don't want to have this done live, which is a large percentage of patients.
Right.
I think when you're doing, more graphic things and things that involve, more invasive things, that's probably not quite ready for live.
Okay. Where can people go to follow you?
So they can follow us on our Facebook page, which is Shah MD, Anil Shah MD.
All right. Thank you so much. We appreciate it.